So thanks you to everyone who joined us today. It's really great to see so many people joining our town hall. This is our time to kind of um, meet and discuss and have some interaction outside of the annual meeting. So thank you all for joining us. For those who I don't know, my name is Brittany Coons. I'm chair of our Nursing and Allied Health professional community up until May 1st of this year. So welcome. So let's get started. So we have a lot to cover. Can everyone see my slides okay? Juliet, you can see these okay? Yes. Okay, perfect. All right, so lots to discuss today. Wanted to talk a little bit about who our current leadership is within nursing and allied health and who will be coming in as new leadership starting May 1st, right after the annual meeting. We're going to review some member statistics, especially within nursing and allied health, talk about some webinars that we have planned and ones that we would like to plan in the future, but also get some ideas from you guys about what you guys want to see in the future for webinars hosted from ISHLT, specifically nursing and allied health. Then we'll talk a little bit about some S&G projects, standard and guideline projects that are underway. And we have some of those people who are leading those projects on the call today that can provide some updates for us. We'll talk about some ISHLT task force that's are also underway. We have some of the leaders of those task force joining us today. We'll talk about the annual meeting that will be coming up soon in April and kind of what to look out for, some special sessions that might be of interest to nursing and allied health. And then we'll start talking about planning for 2026, which I know you're like, we haven't even done 2025 yet. Why are we planning for 2026? But it comes up really quickly. So just want to get people starting to think about that so we can make sure that topics of interest to nursing and allied health are continuously represented at the annual meeting every year. And then we'll end with having some discussion and questions. Right now, this session is recorded. And then we will cut the recording when it's time for discussion and questions so that you can feel comfortable discussing freely whatever it is that you would like to discuss. But we will record the first half here in case those who can't join us, they can listen to this later. Okay, so for our current leadership, we have here. So I represent Early Career and Trainee Committee. We have two members at large, Christiane and Sarah. And then we have a nursing and allied health representative on each of the IDNs, to lung, to MCS, to heart, and to PVD. So this is our current leadership. We have a few people who are going to be leaving and then two new people coming in. So Morgan Wall will be replacing me on the Early Career and Trainee Committee. Morgan is from Inova Fairfax, and we're excited to have her join us. And then the second person we're having is Christiana, who will be joining us from Montefiore Medical Center, and she will replace Edith as the heart failure and transplant representative. So we're excited to have them. Their terms will start on May 1st, and their terms will be 3 years. So they'll be on the leadership committee for the next 3 years. Then I think after that, I think it's PVD that will be up next. And Juliette, I'm not sure if I'm correct, but I'm pretty sure that in the fall there will be a call for anyone who wants to apply to represent nursing and allied health on the PVD IDN. So keep an eye out for that. And that term would start next May. And then the cycle after that would be for, I believe, MCS and lung after that. So keep a lookout for ways to get engaged and to be on the Nursing and Allied Health Leadership Committee. And then I also want to mention, I'm chair now, but I'll be cycling off. And I want to announce that Christiane Kugler will be our new Nursing and Allied Health chair for the 2025-2026 year. So we're really, really excited to have her kind of take up on this leadership role. All right. So now I wanted to go over a little bit of our professional community membership. And you can see here that nursing and allied health makes up about 6% of ISHLT, which is down a little bit from last year, which was about 9%. And it's unclear why our percent has slightly dropped. Maybe that's something that Greg and membership will have a little bit more information on. But I will note that, I don't think that everyone who could be in nursing and allied health has joined our professional community. I think one, people may not realize that you can belong to more than one professional community. So you can be in nursing and allied health, and you can be in pulmonary community. The second thing I think is that people may be unsure of who kind of belongs within nursing and allied health. This is a very broad group. We have nurses at all different levels. We have social work, we have psychologists, we have physical therapy, OT, nutrition, perfusion, pharmacy. So I want to encourage all of you, if you know someone who would be a good fit for nursing and allied health and who hasn't joined our PC, encourage them to join us. And I think that will help grow nursing and allied health within ISHLT. And I do think there is room to grow because when you look at the breakdown here of ISHLT memberships, you'll see over here that 18% of ISHLT memberships are non-physician. And I just said only 6% are within nursing and allied health. That's only about 1/3. So I think there's room to grow here and people who we could recruit to join our RPC within nursing and allied health. The other thing here is that we're an international society. We love our international perspectives. But you'll see here that 3/4 of our members are from North America. And then our next biggest group is from Europe. And then the last kind of breakdown here you can see is the spread of our IDNs and where kind of people are. And you'll see that broken down by IDN, our advanced heart failure and transplant is our largest IDN with about 53%. And then next, about 1/4 is advanced lung disease. And then our remaining about 20% are MCS and PVD. That's kind of a little bit breakdown of who is where within ISHLT. So next, we'll talk about some things of how we stay engaged throughout the year. So ISHLT wants to be a 365-day society, and they are. And there's a lot of things that we do throughout the year outside of the annual meeting to try to increase engagement. So one of the things that we do is that every PC hosts a town hall, which is what we're having today. We have at least one a year. And the other thing that we host is that every professional community hosts a webinar. And many of the PCs have already had their webinars. You can see all the dates listed here. We have our Nursing and Allied Health webinar scheduled for March 11th at 2 o'clock. And the registration for that will open soon. So you can register to attend that. And the topic for this year is a really great one that we're really excited about. And this session was put together by Angie Valeka and Meg Ferguso. And it covers a topic that nursing in particular has been really interested in. There's been lots of discussion at the annual meeting, during the networking session, on ISHLT Connect about how do we do what we do? How are different transplant programs running? So we're going to have this talk is going to be titled Everything Everywhere All at Once, Current Trends in Transplant Nursing and Allied Health. And we're going to have two talks. Well, we're going to have two topics given by two speakers. So the first one is going to really focus on professional advancement within transplant nursing. And those speakers will be announced soon. And then our second topic for this webinar is going to be focused on onboarding practices for transplant professionals. And we have one confirmed speaker waiting on one more. So we'll have two talks and then we'll have plenty of time for questions and answers and for people to kind of talk about how different models of care are being implemented at their centers. So we're really excited for this topic. Some future webinar ideas that we're working on. One is a joint webinar or maybe a workshop. We're not sure what it's going to look like yet with the American Society of Transplantation. So I reached out to the chair of the American Society for Transplantation, their Psychosocial and Ethics Committee chair, because there seems to be this really big interest in how we're doing psychosocial assessments in transplant. That was a big topic on our ISHLT Connect in the past month or two, and there was a parallel discussion happening on AST's discussion board also. So we're thinking about having this joint webinar to really focus on existing psychosocial consensus documents, thinking about the existing tools that exist, what they are, who's administering them, when they're being administered, thinking about how psychosocial assessments are being integrated into clinical care and decision-making, what the limitations are of our current tools that we have available by organ type, trying to introduce an international perspective. What are our international colleagues doing for psychosocial assessments and how are they being integrated into decision making? Thinking about the ethical issues that surround these topics, and then having discussions about directions for future research. What are the important concepts that we should be assessing? How do we intervene? And having lots of time for panel discussions and open discussions related to this topic. So we are thinking of trying to plan something for fall of 2025 with AST. So that's one kind of future webinar or workshop that we're working on right now. We're also thinking of a joint webinar between ISHLT Nursing and Allied Health and the International Consortium of Circulatory Assist Clinicians. And one potential topic is to review one of our recent guideline updates and have a session focused on that. So that's also in the works. And then we're also thinking about having another webinar focused on APP fellowships and transplant practice models. So lots to come, but one of the things that we can discuss at the end of kind of this presentation are what topics do you want to see covered through webinars, or what other organizations do you think that we should partner with to have these joint kind of webinars or workshops? So start thinking about those, and then maybe we can talk about that in a few minutes. All right, so now we're going to talk a little bit about the ISHLT Nursing and Allied Health related standard and guideline projects that are under development. We have two, and I believe we have both people here that can give us a little bit of an overview of what the purpose of this consensus document is, what the status is, when can we kind of expect to see things in press to be able to read these updated guidelines. So first is the engagement of social support systems in patients being considered for and following advanced heart and lung therapies. And I think Colleen is on to give us an update on that one.
Great. Thanks, Brittany, for having me. And it's great to see so many of you. I am excited about this consensus statement, and actually the webinar you presented for fall of 2025 may align very well with our goals of publication. But I am working along with Samantha Anthony, Fabian Davos, Cassie Kennedy, Michael Petty, and Melissa Sanchez. First, I just want to say thank you to all of them. They have been an amazing leadership team. And I also see a lot of people on that are part of the writing group. So we have had great progress. Initial drafts are in. We are currently reviewing. We had a meeting actually earlier today among our leadership team, and we are currently on track with our plans to submit for final publication in fall of 2025. So what we are aiming to do is really talk about the social support systems that help to provide care and resources to patients before and after advanced heart and lung therapies. So it does encompass pretty much all of the patient populations that encompass ISHLT expertise. That being said, it's a little bit difficult to hone in on, and as many people know, there's a wide range of how social support is handled across the world. So we are focusing a lot on the caregiver, but knowing that the social support system is made up of a lot of people and other resources. So hopefully can provide more updates in the coming months, but so far we are just thankful to the Nursing and Allied Health Committee for supporting this and moving this forward.
Great. Thank you. I'm excited to see that come together. We have a psychosocial consensus document that came out in 2018, but I think this idea of focusing on social support, a greater focus on that will be really, really helpful. So excited to see that. Also really grateful that you just gave me time to breathe, because at 38 weeks pregnant, my lung capacity is like this small. So I'm like out of breath as I'm talking here. So thank you for that. Our next SNG project that is underway right now focuses on palliative care, and I think Christiane, you're on to give us a little bit of update about where we're at with that one.
Sure. Thank you for giving us space for that one. And thanks to my fellows, which helped that project to write. So thanks to Kathy Grady being here. And I've seen Megan Fregoso joining us today. The palliative care project is a consensus statement on the topic of palliative care for this patient population and is led by Rebecca Coleman from Toronto, from Canada, Kale Hope, focusing on the pediatric section for that statement. He is located in Houston, in Texas, which I crossed just yesterday, and by myself. We started a little bit later in comparison to the social support project, so in late November. Are in the process of researching and analyzing the literature and to write up the paragraphs um, according to the outline for the palliative care project. So we will start with a conceptualization of palliative care. We'll assess guidelines currently available for the patient populations on heart lung transplantation, and the MCS populations for both adults and for the pediatric populations, and will focus on the needs of these patient populations. First draft being due by the beginning of March this year. And when we look at the print date, that will take a little while longer. And it's due December 2026 when I have it correct in my mind.
Great. Looking forward to that one also. I know that's been a hot topic that has come up a lot about how we're integrating palliative care into our practices. So excited to see that document. So thanks for all the work you're doing on both of those. So in talking about SNG documents, every 2 to 3 years, I'm told ISHLT puts out a request for ideas for new SNG documents, so things that are not covered, and that's how the social support one came about, and that's how the palliative care one came about, because we have not had documents on those topics yet. Or thinking about identification of SNG documents that need to be updated. So maybe things that seem to be outdated, there's new evidence out that we need a new consensus statement on. And I believe that this request will come out this year or next year. And so we want to be prepared to advocate for your ideas. So if you have an interest in some of these consensus documents, or you think like this is a topic that I keep hearing about and there's not much evidence on, we don't have an SNG document on, you can go on the ISHLT website and take a look at ones that exist. So you can identify a gap or identify ones that are outdated. And feel free to reach out to someone on nursing and allied health leadership and kind of express interest. It doesn't mean that you have to lead it or that you have to be the sole one, kind of organizing all of it, but you can just throw that idea out there and it's something that we can then propose to ISHLT. So start thinking about that. Also, if you're interested in getting involved in one of these SNG projects, keep a lookout in your emails and on ISHLT Connect, because that is where you will get a call for volunteers to sign up to potentially participate in one of these on the writing groups for these SNG documents. There will be leads for these SNG documents. Sometimes there is a ton of people who want to participate and volunteer on the writing group. And so that writing group has to be condensed down a little bit and people will be chosen. But if you're interested in volunteering and for one of these documents, just keep a lookout for that. That's how you would sign up to be a volunteer for one of these projects. So start thinking about maybe some documents that we could propose for the future. So the next thing we have here are some nursing and allied health relevant task force that are underway. So within ISHLT, we have, these IDNs, we have professional communities, but we also have these task force. And we currently have at least 2 that I can think of that are of interest to nursing and allied health. And we have people who are on those task force on the call here that can give us some updates on the pediatric to adult transition task force and the patient engagement task force. So the first one we have is the pediatric one, which I think both Angie and Kathy are on. Melissa gave us some slides. I don't know if either of you want to kind of speak to any of these.
Hi, Brittany. Yeah, am I able to forward her slides or somebody? Oh, okay, great.
I'm doing it, so you can just let me know when to move.
Awesome, awesome. Yes, so this task force has taken off. We're already underway and have had a couple of meetings led by Miranda and Melissa that you see here. Miranda from Australia, Melissa from University of Michigan. I think many of us know Melissa, and I'm sure she's sorry she can't be here today. And this is really and Kathy can jump in too, but this is a large overarching project, really looking at kind of where we are with pediatric transition in heart and lung transplant, both on the pediatric side as well as on the adult side. So it is all encompassing, which I love. So there's representation from both sides of this challenging problem. And it will, we're looking at, like I said, mechanical circulatory support, heart and lung failure, and just these transplant populations and the transition. So that's the charter goal there. I don't need to read it out for you guys. You can go to the next slide. So there, as you see here, there are 18 members. I think it's very exciting that 30% of the membership is nursing and allied health members. And you can see those individuals listed. So it's a great group of knowledgeable people in this field. Next slide. So one of the first things I think that the group wants to do is really look at what are current practices by sending a membership survey. And we've looked at some examples of some surveys, and I can't think are in the beginning phases of putting that survey together to send to membership to sort of understand, what are programs doing right now to help these populations transition, and then what are adult programs experiencing and receiving these patients, and where are the real needs for this task force. So there is definitely ongoing discussions about, looking at some registry partnerships. And I think it is important too, in looking at there's some webinars that we've already, Kathy gave a really great presentation on some work she's done in this area with pediatric transition. We're looking at other best practice, processes that we can invite for webinars to inform the task force. And then we are hoping that we can gather enough information that we'll be ready to have a consensus meeting at the ISHLT Toronto meeting in 2026. So we're in the information gathering stage right now for that upcoming consensus. I think you can go to the next slide.
I think that was the last one.
Oh, okay, great.
So thank you. Thank you.
And then I don't know if Kathy wants to add anything to that, but I think we're in the early stages, but already I think the kickoff has been really exciting. And there will be a meeting of the task force at the annual meeting in Boston.
Nope, great job, Angie. I don't have anything to add. I think it's real exciting, and it's multidisciplinary, and we've got a lot of challenges to overcome with these young adults who transition from peds to adult care.
Absolutely.
Thanks.
Well, thanks for the work you're putting into that task force. We're excited to see what comes out of it. Our second task force is co-chaired by Meg Fergurso, and this is the ISHLT Patient Task Force.
Thanks, Brittany. Thanks, everyone. Yes, very excited about the ISHLT Patient Task Force. I am co-chairing with Dan Dilling, who is a pulmonologist out of Loyola. And we have 14 members in our task force, including, and then in addition, Greg Schultz, who is our CEO, and then Shanita is our foundation support. The background to the forming of the task force was ISHLT's realization that there was no kind of formal strategic approach to include patients and family perspectives in the work that we do in ISHLT. Patients aren't currently mentioned in the ISHLT mission or strategic plan. And really, patient involvement in ISHLT has been kind of ad hoc and as needed. So the board of directors and the leadership advisory forum considered the issue. And then they met at the annual meeting to consider the task force, and then nominated and invited members to join. So our task force is comprised of nurses, coordinators, nurse practitioners, physicians from MCS and lung transplant, heart transplant. We also have patients represented like Glenn Kelly, who, if you were at the last meeting, the annual meeting, is very well known to the transplant community and works with Mended Hearts and spoke at the last meeting. We have leaders of a couple of organizations like the Lung Transplant Foundation and Transplant Families. Folks are international from around the world. So it's been really exciting to get everyone's combined perspectives. And I think everyone is very engaged and excited about this project. So our focus is to identify key opportunities for patient engagement. And as I said, the membership was finalized in September, and we've begun our meetings. So our initial meetings focused on really defining patient engagement, prioritizing strategic goals, and aligning deliverables with ISHLT's mission and values. And, we wanted to continue to see ISHLT as a scientific, professional organization, but allow patients and families to be included in the work that we do. A draft mission statement and interim recommendations were presented in January at the leadership retreat. And right now, we're currently identifying and ranking ISHLT programs most suited for patient engagement. We have quite a few more meetings planned over the spring, and we'll meet at the annual meeting, finalizing recommendations for patient involvement in May of 2025 to present to the board in July 2025. So it's coming along. We've had, again, a lot of excitement and a lot of great ideas. We have so many great ideas. It's really been challenging to kind of condense them into a starting point for deliverables, but we're getting there.
Thanks, Meg. And I'm on that committee with Meg. And it is an exciting committee. It is, a lot of work also. And as Meg kind of alluded to, the goal isn't really to create a patient membership within ISHLT. It's still to keep this a professional society, but thinking about how do we engage the patients, either in the webinars that we conduct. So Meg and Morgan gave a webinar last year that engaged some patients, thinking about the Patient and Family Advisory Committees and invited patients to speak during that webinar, or thinking about, these consensus statements that we talked about today. How do we get that information to patients? How do we kind of maybe make a blurb that has more like lay language in it so that patients and families can understand? So thinking about how do we best serve patients and families? So really excited for that one. And thank you, Meg, for all the work you've put into that.
Thank you.
All right, moving along. We're going to have Angie back again to talk a little bit about a consensus conference that she has been working on with a few others. And I can advance her slides for you, Angie.
Thank you, Brittany. Yeah, I think some of you on this call, I am sure, remember well over a decade ago, more than a decade ago, that through ISHLT, there was an initial nursing consensus conference, kind of just trying to, this is honestly, I'm on listserv, so this is just ongoing, an ongoing challenge to resolve, but looking at, the makeup of the role and work of the nurses in transplant programs and APPs in transplant programs and how the work is getting done. And we wanted to revisit that. And there is a lot of interest, I can just say, across all organs to discuss and revisit this topic. I am co-chairing this consensus conference with Dr. Bernice Coleman. You can forward to the next slide. And it has received some really robust response. I will just mention, and I had kind of wanted to ask you, Brittany, when you were showing us the makeup of ISHLT, I would love to have a little bit more information about our own nursing and allied health community. It is a challenge. We kind of tried to mimic the process on the prior consensus conference because it worked well. So we were reaching out to the medical directors of small programs, medium-sized programs, and large programs, both on the heart and lung transplant side. This does not include MCS programs or pediatric programs, and that's because we all, I think, recognize the unique nature of those populations, and the care that is provided to those populations is very different. So we really were, you have to start somewhere. So we really wanted to tackle this from a heart and lung transplant perspective, which is what we did before. So we reached out to the medical directors of programs and basically said, this is what we're doing, outlined kind of the agenda and the process, and asked them to please submit the individuals they feel can provide expertise and discussion for these kinds of topics. Unfortunately, these medical directors are sending a lot of people who are not nursing and allied health members, and it is creating challenges. You can forward to the next slide. So this just talks a little bit about the paper that was published in 2015 and sort of what we were trying to get to. We were, as always, trying to get the albatross of proper staffing levels, and I just think that it's really difficult to determine that, given that models of care are so varied within institutions. So part of our hope is that we can get to the bottom of some of that, maybe in some of these discussions. This is going to be, will be a survey sent out to nursing and allied health membership with some very specific questions. And that survey is what we will use to sort of inform the discussion. And this was very similar to how we did this process in the prior consensus that was held a decade ago or so. There have been a lot of changes, I think we all know, in transplantation and how the work gets done. There are, especially in the call space and in the actual procurement space. So we wanted to tackle some of that. I think you can go to the next slide. One of the things, in addition to sending the survey, the other problem that we were experiencing is that, sadly, even though medical directors from outside North America were sending us really great people, those individuals have no funding to travel to the US for the meeting. So one way that we want to try to incorporate those individuals is by holding some virtual roundtables prior to this meeting, where we can get the thoughts and input of those individuals. I think, Brittany, you're aware, there were two people where medical directors were like, these individuals have published papers and they're well known in this area. I didn't know them. They're from outside the US. So I have tagged two of those individuals to be part of the webinar where we're talking about onboarding and career ladders, and one person is going to be actually moderating because she's published a lot in this area, and she's from Sweden. So neither one are members, but I know we can do this, and I'm just hoping this will generate some excitement within those individuals to want to be part of this community. So if you look here, these are some things that we were thinking of discussing in the roundtable, and there may be more borne out in the survey that we may want to tackle before the meeting. But you know, if you read this, you know, the call team creation, administrative burdens for transplant nurses, how virtual and telehealth and remote monitoring, and honestly, even hybrid and remote work has changed transplantation in the space. So these things listed here were just some ideas for the virtual roundtable, and when you get the survey, you'll see that some of that is on there, so that will, like I said, help inform the discussions. And then you can go to the next slide. Oh, okay. So I did want to say that we are challenged right now, and although we have had board approval, we do not have S&G approval to have this consensus, and we're awaiting that. So that's why you haven't received this survey. I will say I feel this is something that our community struggles with. We are a multidisciplinary community, which is great, but this particular topic is specifically nursing related. So when I'm asking Brittany, when you talk about membership, because one of the issues for S&G is, well, we want it to be your membership from Nursing and Allied Health. But as you know, our membership is not just nursing. This topic is just nursing. So my first question would be, when you look at our community, what are the disciplines and how is that breakdown? And then when you look at our community, and let's just say we say, okay, 50% of our community is nursing and allied health, and we're trying to meet the 3 Gs. I think we all know that in nursing and allied health, we just aren't going to meet gender. It's just not going to happen. Although I do have some guys coming to this, it's really hard to meet that. And then the other thing on geography is the just cost and expense. I think we always struggle with that issue. And so if you looked at our membership and looked at geography, I think we would find that, you know, we're struggling there. So I hope that S&G will recognize the challenges that our community faces in this space. Every single medical director that we queried was certainly an ISHLT member, but we, you know, kind of are held to who they recommended as their thought leaders for the program. That doesn't mean that we aren't going to invite other nursing leaders within this community, even if, you know, that wasn't the recommendation, because we know that there are a lot. But our whole entire membership, the goal is to survey everyone so that there will be input and response. So enough on that. I could talk about it all day. So I do think it is only fair that I mention this is a goal that we have, and we put a lot of work into it, but it is not fully approved yet. So that's why you haven't seen a survey come your way. We're hoping soon that it will get the approval. Thank you.
Thanks,
for your attention.
I think this is such an important topic, and I think one that you hear at the annual meeting in the hallways and before sessions. And I know people have come up to Meg and I after, you know, the networking session with specific questions about, what are you doing about donor call? How are you onboarding new practitioners? What resources are in place to help with advancement? So some of these topics that you've put together for our future webinar in March and future webinars that you have planned. So I think this is such an important topic, and you see it on ISHLT Connect. Someone just recently posted asking about taking call and what that looks like at different programs. So please respond to those discussion board posts to really get this discussion going, because a lot of people, I think, have similar questions and want to learn from each other. So thank you so much for putting the work into this. I think this is much needed.
And I'm just going to say, if you're on S&G and you're in this community, please support and, you know, give a shout out for what we're trying to do. I do think what was interesting to me is that, you know, the physician leaders were unbelievably enthusiastic. And I'm sorry, I'm not sure they're always aware of the day-to-day struggles, but they were, and they were like, I'm so glad you're doing this. So I was really impressed to see that response. So thank you for the time.
All right, so more to come on that. Now the annual meeting, which I'm sure all of you know, is going to be held at the end of April in Boston, and registration for that is now open. Also, remember to book your hotel. I forgot to do that last year until last minute, so please remember to do that. In addition to the annual meeting, the day before the annual meeting starts, there are some pre-conference workshops that may be of interest to you. This is a separate registration. So if any of these topics are of interest to you, take a look on the website. You can see the different topics that will be covered in each of these sessions, and you would register for, I think you can only do one of these. I think these are all-day sessions, if I'm correct. But definitely check those out if you're planning to go to the annual meeting, and that those will be held on Saturday, and then the annual meeting will start on Sunday. I'm not going to go through all of these, but there's a lot of really great topics that are being planned that I think will be very relevant to nursing and allied health on each of the days. So I just kind of went through, you can look at the program viewer online, and I just went through and looked and found some sessions that are really interesting that we have moderated by Nursing and Allied Health, that we have Nursing and Allied Health speakers within these sessions, or just topics that are really would be of interest. And there's some really cool ones this year that I was looking at. For example, on Monday morning, the Candidate Selection Live session is like a different type of session that looks pretty interesting. What they're going to do is discuss candidacy dilemmas, things like managing comorbid mental health, thinking about patient-caregiver dyads, substance use, patient education, and self-management from a distance. And before each speaker, they're going to present a patient, and the audience will vote on candidacy, and then we'll hear from the experts and determine whether their expertise will sway your vote. So that's kind of a interactive, cool session that you might want to check out on Monday. And then the other one that I thought sounded really interesting, I think they all sound very interesting, but another kind of different one is the role of the caregiver in heart transplant replacement therapies. That will be on Tuesday. And what's cool about that is it looks like they have a pro-con debate planned for the end of that session, which pro-con debates are always interesting to watch. So take a look at the program viewer, start planning where you want to be. But we hope to see you at the annual meeting in April. And the other thing to look out for is that each of the PCs will have a networking event on one of the nights. And our networking event will be on Monday night. I think it's going to be at 6 p.m. for Nursing and Allied Health. And it will be set up more like it was in Colorado, so 2 years ago, where it's going to be a little bit more informal. There'll be chances for you to kind of walk around, network, and talk with people rather than a formal meeting. So please join us for that. I think they'll have like drinks and maybe appetizers out, hopefully, like they did with Colorado. And it's just an opportunity for you to meet others within nursing and allied health. Let's see. All right, and then thinking ahead to 2026, the annual meeting will be in Canada, in Toronto, Canada. That will also be held at the end of April. And the reason I'm bringing this up is because what typically happens is we go to the annual meeting in April, we come back, and then all of a sudden it's like symposiums for the next annual meeting are already due in June. And symposiums are our opportunity to kind of develop content for the meeting. So want you to start thinking about this early, start thinking about this while you're at the 2025 meeting, thinking about, well, what's missing from this meeting? What topics do I wish were being covered? And that way, when you can come back, you can start thinking about these, how to develop these sessions. And one thing that I think we did last year that was really helpful is we hosted these nursing and allied health symposium brainstorming sessions. We had a few sessions in May and June. And really what those are is an opportunity for you to come with your ideas, and they do not need to be fleshed out. You do not need to have an outline. It can be very simple, like, I want to develop a session on social support. And then others might have interest in that, and you can kind of connect with others and start thinking about, okay, well, what topics related to that broader topic do we want to discuss? Who would be good speakers? So you can kind of develop those sessions together. This was really successful. I think we had 5 or 6 sessions or symposium proposals that were submitted from nursing and allied health members. And they don't always get accepted in full, but some of those talks get accepted and combined with other things. So I think it's something we're going to try to do again this year. It's just an opportunity for us to get together and to start working on content together, and it makes this process a little less intimidating. So keep a lookout for that. We will announce it on ISHLT Connect when those sessions are. They'll be held virtually over a Zoom meeting for like an hour, once a week, and you can stop in when you can. And then thinking about if you have abstracts that you want to develop, those will be due in October. So the symposium session proposals are due in June, and then the abstracts are typically due in October. And that's if you have your own kind of research or quality improvement projects that you want to write up as an abstract and then submit. Those would be in October. So just keep those dates in the back of your mind so we can make sure that nursing and allied health relevant content continues to be a strong presence at the ISHLT meetings. All right, so now's our time to kind of talk a little bit. We brought up a lot of different things. We brought up webinars. If anyone has ideas about topics you want to see covered or organizations that you think we could potentially partner with to cover some of these topics, or if you have thoughts on S&G documents, or any other ideas about what we can do to kind of stay engaged and connected over the year outside of the annual meeting. Or if you just have questions about like how things are run, kind of anything, this is our time to connect with one another.